Let's take round one.
Alright. I'm going to start her up. Stop doing your thing. Go for it. Welcome back to Talk 1260 KTRC Western Medicine with Dr. Daniel Ronel, my wife Betsy Ronel, and our very special guest, Marian Urban. We're going to talk about laser therapies.
Thank you, Dr. Ronel and Betsy, and welcome back everybody to 1260 KTRC. This week we're going to be answering some of your most common questions about laser, and Betsy will ask those questions as if they were coming from you. Betsy, do you have any concerns or questions?
Sure. So what are all the things that the lasers that you use can do?
Well, the laser that I work with comes made by the company called Cutera, and we have the Cool Glide, also known as Genesis, which is a YAG laser. Don't go into the terminology or technology names of that because it confuses people even more.
Yeah.
Then we have the IPL, which stands for Intense Pulse Laser, which is for photofacials, brown spot removal, redness, and then we have the ProWave, which is hair removal.
I've had all three of these applied to me, haven't I?
Yes, you have.
Okay.
Yes.
They're great.
One of the myths people always have is that they think one treatment's going to do it.
Right.
And laser doesn't work that way. Let's just take one laser at a time. For example, we'll take the YAG Genesis Cold Glide, which works on the ruddiness and redness of the skin along with vascular. So it requires 6 treatments because the laser has to work at a pace where we don't create damage to people. Now granted, there are some cases where you just cannot help it. Certain people, I learn as much as they do on the journey of laser. If you're overstressed or if your hormones are imbalanced, the laser will react different to everybody. So, but you always have to have 6 treatments because we go gently on the path of laser.
Yeah, we don't want to create people that look like Freddy Krueger or that big burn that takes 2 weeks to heal.
Right.
That's true.
I mean, that has its advantages, but that's not the laser we have. We chose one.
That's not what you do.
No, that's not the laser we have. However, even the gentlest, mildest lasers can create a Freddy Krueger.
Just let Marian talk. This is her field.
But it's okay. But anyway, the IPL especially, we have to be very gentle because again, it's an intense pulse laser. I can take her skin, Gino's skin, your skin, my skin, use the same jewel on everybody, and everybody will react different. So the beauty of lasers today is that you can pre-program the skin type, the skin condition, the thickness of the hair, etc., etc. So before, like 10 years ago more, when the lasers first came out, they were frightening. And I have to say, we were putting little holes on people's faces, and I backed away until they refined them more. And today, they're very safe. There is a variety of different lasers. The big laser came out for doctors called the CO2 laser.
Right.
The name CO2 is a very serious name for a laser. And that was basically in physicians' hands only, because that would leave you like Freddy Krueger. But it's a beautiful laser, though. It gets you the results you want, but the people have to be willing to go down that road. And then comes the Fraxels.
Wait, I've got one question. What is the CO2 used for? That's for like serious
Resurfacing.
lines.
Oh, it's
right.
But you know, I compare the CO2 laser to, if you remember a long time ago, they're still around, they still do them, what was called a dermabrasion.
Right.
Remember those dermabrasions? Well, I mean, they took practically your whole skin off, okay? Rearranged your skin. It was like a facelift, but, you know, much more crucial. And so the CO2 kind of has taken the place of that, because it really just burns the whole face. And it's many months for the skin to heal, many months for it to heal. So then they came out with Fraxels. Now again, Fraxels are beautiful lasers in the right hands.
Right.
And now they have different Fraxels.
Right.
So the laser world keeps changing, but the one that we have at our office is a very gentle laser, and anybody can do it, and it's very effective depending on people's skin condition. So we can get the results we want. Sometimes it might take 6 treatments, and sometimes it'll take 12. I always meet with people and say, how fast do you want to go?
What do you use the Fraxel for?
Fraxel is completely different. That's really more like underneath the CO2 for resurfacing. that has like 3 to 4 days downtime.
Okay. Wow.
We don't have that one.
Yeah. Oh, okay. Okay.
No, we don't have that one. And the other thing with laser, anybody can do laser if you take a weekend course.
Right.
Of doing laser. Anybody can. But
Watch out, everybody.
Yes. But I think laser work is very serious. You shouldn't just apply a laser and shoo away.
No.
You really need to know what it's like. The skin to me is like a canvas. So you have to know what you're going to do. If one laser's not doing it, it's almost like, well, this is the wrong brush. Let me pick up another brush.
Right.
And that's how I work with the laser. It's more on the skin that I do the lasers. And now we go to hair removal, and lasers will not phase white hairs
Right.
or really light blonde hairs.
Yeah. What's the best skin hair combination for this hair?
Well, skin is secondary,
Okay.
but the darker the hair, the better. But what I'm after is not the hair.
Okay.
It's the bulb. It's people would know it as the root, the bottom part, the bulb, the root.
Right.
If it's black, that's what I want.
That's most blondes out there.
So,
Kidding.
black. Anyway, so like this morning I was doing, and it's, if they're not used to the laser, it's very uncomfortable, but I try to be there with them and try to say, one more shot, one more shot.
Yeah. Oh, it
But the
hurts.
best thing about it is like when you see the hair follicle bulb popping out, that's a very successful laser.
You feel it too.
Mhm.
Yeah.
Bikinis and underarms are very successful hair removal. Legs secondary, but the finer, lighter hair, the more lasers you're going to have to do.
Right.
More treatments.
Okay.
So-
So let's just recap. What are the 3 lasers you use?
We use the Genesis Cool Glide, which is vascular, redness, ruddiness, collagen stimulation, pore minimization. So it works topically, but the heat works underneath the skin. Then the IPL stands for intense pulse laser. That's for brown spots, aging spots, melasma. That's pretty much it in photofacial. And then you have the hair removal, and that's self-explanatory.
Okay.
Right.
Great. Wide variety of stuff.
I think the hair removal we have, what is very special about it, it has a very wide panel. And so many hair removals require lots of treatments because it takes a long time to move the head of the laser over all the hair. When we have a nice wide one, so you can do a large area quickly. So that's one of the advantages. That's why I got it, is because you can get people in and out quickly and do all their hairs.
Right. But people have to understand the other thing. We have a few seconds. Is there's a variety of prices out there, and I have to tell the consumer that we have to watch the price, because you might get a laser for half price and this and that, but you have to be careful as to who's doing the laser, how updated is the laser, how advanced is their training. So you might be paying less, but be careful with what you get.
Right. This is your skin. This is your
Yes.
beauty, and you
Yes.
do get what you pay
And you
for in
get,
this business.
I was just going to say
Yeah.
that. We're talking with Marian Urban about laser treatments. This is Dr. Daniel Ronel. You're listening to Western Medicine on Talk 1260 KTRC.
Thanks,
We'll be right
Marian.
back. Thanks.
Thank you.